Hello and welcome to Askimo TV. We're talking today to Dr. Robert Greenbaum. Dr. Greenbaum is a senior cardiologist working in London at the Royal Free, Barnet and Wellington hospitals. He is a past president of the cardiology section of the Royal Society of Medicine. He treats the full range of adult cardiology and has a particular interest in coronary angioplasty and implantation of pacemakers. Hi, Dr. Greenbaum. How are you?
Good morning. I'm fine, thank you.
Dr. Greenbaum, let's talk today about angioplasty and coronary artery surgery. So what is coronary angioplasty?
Coronary angioplasty is a technique where we widen the narrowings which develop in patients with angina or who may have had a heart attack inside the arteries that supply the heart with blood, what we call the coronary arteries.
Who would need coronary angioplasty surgery?
Well, there's really two groups of patients. There are patients who come along, you see initially usually in outpatients with stable angina, and they have a variety of investigations, and often these days they're not adequately controlled with medical treatment, so they go on to allow us to shoot some dye down the heart arteries to show where the narrowings are in the arteries. And then we consider whether or not they would be suitable for angioplasty. The other group of patients are patients presenting much more as an emergency with a heart attack or a very bad attack of angina, what we call unstable angina.
What causes a person to have narrow or blocked arteries?
Well, there's no simple factor. There's certainly an inherited tendency. So patients who have a close relative, a parent or a brother or sister, who have coronary problems before about the age of 55, we know that they're at much higher risk. Diabetics are at higher risk, and patients with raised cholesterol and high blood pressure are also at increased risk. And of course, people who smoke are at much greater risk. And often these factors cluster together, so often there'll be a number of features in any particular patient.
Talk me briefly through the procedure of the surgery and what a patient can expect to happen.
Right. Well, angiography and angioplasty are done under local anaesthetic, so I emphasize to patients they're not actually asleep. Routinely, I would give them sedation. There's two ways mainly that we access the circulation. The first is through an artery at the top of the leg, the femoral artery, and the second is through a little artery at the wrist, the radial artery, and that's becoming much more popular now. Probably a third to a half of cases are done through the wrist. Once we've gained access to the circulation, we pass a fine tube along the artery into the heart. Patients are worried that this is painful, but actually you can't feel the tubes inside you. Once we've positioned the tube just at the beginning of the artery, we shoot a special dye down the artery, and this enables us to see the narrowings that are present there. So that's angiography.
Tell me, what are the risks, if anything, to this procedure?
Well, the risks of angiography that I explain to patients, I say to them it's very safe but not completely safe. So the risk of an angiogram is around about 1 in 1,000. So it's around 99.8 or 98.9% safe. And the major risks are dying or having a stroke or a heart attack. But you have to remember we have to balance the risks of the procedure against the potential gain for the patient, that they may have a potentially dangerous narrowing which is suitable for treatment, and we can improve their symptoms and hopefully their outlook.
So what is the prognosis for recovery after the surgery, and should patients be aware of any lifestyle changes after surgery?
Yes, it's very important to change your lifestyle after the surgery. It's a bit like, I compare it with buying a car. If you look after it, if you do things we advise, lose weight, keep your blood pressure and cholesterol down, usually with medication, and take usually aspirin and possibly other similar tablets to try and keep your arteries clear, there's no doubt that you can improve the outlook. When we've done angioplasty, we've gone beyond just taking pictures. We put a fine tube down the artery, and at the end of that tube is a small balloon which we've blown up and pushed the narrowing back into the wall of the artery. We then take that balloon out and usually put a second one on with a little metal coil that we call the stent. We blow up the stent, and that is pushed into the wall of the artery to hold it open, and we then deflate the balloon and remove it. And then when we're finished, we remove all the tubes and stop the bleeding.
Thank you, Dr. Greenbaum. Thank you so much for talking to me today.
Thank you.